Hi, I am Dr. Robert Hamus. I'm a plastic surgeon in private practice in Dallas, Texas, and the inventor of the Ideal Implant. I want to welcome you. If you're watching this, you're among a very small group of practices throughout the US and Canada that are going to have access to the Ideal Implant. The idea for this implant came from listening to my patients. I realized women want an implant that combines the desirable features of both saline and silicone gel. To develop this new type of implant, I founded Ideal Implant Incorporated in 2006. My criteria for this implant was that it contained only saline and yet feel like silicone gel. And over the last 10 years, we've refined the design and the manufacturing quality and have conducted a large US clinical trial of over 500 women. In November 2014, we received FDA and Health Canada approvals. When women compare the original saline implant and silicone gel implant in their hands, side by side, as they probably do in your office, it's easy to understand why women would tend to choose silicone gel because of its feel over the original saline. On the other hand, women do like the safety of saline in their bodies. There is no structure to this implant, however, so it tends to bounce, as you can see. Also, when held upright, the upper part of the implant, the upper pole, collapses, and you can have quite a bit of wrinkling around the edges. Deflation is total and obvious because there's only one chamber here, and when that happens, women want immediate replacement. This creates a scheduling issue for your practice. On the other hand, the silicone gel implant has the feel that they like, but the rupture rates over 10 years are much higher than any of us thought. It is 10 to 24% in the MRI cohort during primary augmentation. And I'm talking about the FDA core studies of both Allergan and Mentor, and they're shown in this table. You'll note that even the gummy bear implant has a very high failure rate. Rupture is usually silent, and that's what really bothers women because they do not know if or when it occurs. Women want to know what's going on inside their body. To know if their implants are intact, if they have silicone gel, they would need an MRI scan, which is, of course, expensive, unpleasant, and time-consuming. The Ideal Implant has an internal structure, so we call it a structured breast implant to distinguish it from the original saline and the silicone gel. This structure supports the edges of the implant and the upper pole. Here it is compared to a silicone gel implant, and you can see that the edges stay smooth and flat. The structure inside also controls movement of the saline so that it behaves like a silicone gel implant. The structure has no new materials. It is the same materials, the batch, the valve, and the shells, as an original saline implant, but there is a series of shells that are nested together inside, 3 to 5 total shells, depending on the implant size. And there are 2 lumen or chambers, one on the inside filled through the back, and one on the outside filled through the front, which provides the saline for the implant. Because there are 2 chambers, the implant won't go flat if one chamber deflates, so you don't have that emergency for the patient. The edges of the implant were designed to be low and fit closer to the curve of the chest wall. Here's photos of an Ideal implant compared to an original saline implant, so you can see that. Also, these photos show the shape of the implant, which is a youthful shape on the curve of a chest wall, and the gel implants for comparison. Compared to high-profile gel, the edges are a little more tapered, and the profile is more youthful and breast-like. Our U.S. clinical trial was for the indications of primary breast augmentation and replacement of existing augmentation implants. Reconstruction was not studied in this trial. We had 502 women who were enrolled. There were 45 board-certified plastic surgeons and 35 private practice sites throughout the U.S. Our longest follow-up is now over 6 years, and our shortest follow-up is over 5 years. We've had high patient satisfaction and high surgeon satisfaction. In terms of deflations, importantly, no implant failed due to a design failure or a fatigue failure. Most deflations were due to an early assembly defect at our trial implant manufacturer in Montana. This was corrected in 2010 when we moved to our commercial manufacturer in Southern California. This large facility is FDA registered and inspected and ISO certified. For over 30 years, they have been building silicone medical devices for companies like ours. The Ideal implant is available in only one profile. It's similar to a high profile, but the sides are tapered more, and you can see this in the comparison photos here, comparing to a high profile gel implant. The shape is very youthful because of that, especially on a curved surface. If you go to our website, you can see side-by-side photographs of the Ideal implant compared to other manufacturers' implants. It comes in a smooth surface only, no textured surfaces, and the warranty is the same for other implants. At this time, we have no sizers available. The implant will be produced in 14 sizes. The outer lumen is adjustable, and the adjustability is in proportion to the size of the implant. So a larger implant has more adjustability than a small implant. You do not need to overfill this as you do other saline implants. It was designed to work at the minimum fill volume. That's fine. We label it high, in fact, so we're making the point that that's sufficient. Do not overfill it. You can adjust up to a maximum volume, which we label 100%, but even at the minimum, labeled high, that's sufficient. A word about volumes when you're replacing implants, something many people don't realize, is for the original saline implant, the shell is not included, and the shell is about 20 cc's. So if your chart says a woman has a 300 cc saline implant, she really has 320 cc's in her body. The silicone gel implant includes the shell. If it says 300 cc's, it's the whole thing. And the Ideal implant is labeled the same way. It says 300 cc's, it's the volume of saline inside, the inner lumen, the outer lumen, and all the shells. That makes up the total volume. We will be sending you materials to use for marketing and for demonstration in your office. You will receive a sizing chart, and the sizing chart is very handy to show patients the internal structure of the implant and explain the nested shells to them and the two volumes. We'll also be sending you a sample implant in this sealed container. Because the implant is saline filled, it must be kept in a moist cloth or the saline will evaporate from it. So when you're not showing it to a patient, you have to put it back in a moist cloth and keep it in the sealed container. Now this cloth has been antimicrobial treated, but in case it gets soiled, you can wash it in the office in the sink. The implant was filled in a sterile operating room environment, so don't put fill tubes in or you may get it contaminated and get something growing in it. The volume was set at high, the minimum, 335 cc's. We'll also be sending you this flesh-colored cloth. It's a polyester cloth that can be washed. It's great for comparing the Ideal implant and silicone gel implants side by side. We've devised a simplified ordering system to make your life easier. No office likes paperwork, so there will be no invoices, no statements, and no return authorizations. You'll be able to order the Ideal implant online and charge your credit card, just as you would buy an airline ticket or order from Amazon.com. The information goes to our distribution center, and delivery will be by FedEx within 3 days. For returns, you'll call FedEx for a pickup. The implants will get back to the distribution center, and when they're received, you will get a card credit. If you do have questions or you need help with anything, please call the Ideal Implant office. We want to be able to help you in any way to make this new product a success in your practice. The Ideal implant is a novel design implant, and it will be marketed in a novel way, directly to women, who we feel are the real customers. Remember, our goal is to drive women to your offices, those of you who are in the limited number of plastic surgery practices that have access to the implant. This very limited availability will create exclusivity, since others in your area will not be able to offer it. Our marketing messages are that the Ideal implant has a natural feel comparable to silicone gel. To demonstrate this in your office, you can put it under this cloth and let patients feel it side by side compared to silicone gel. When that happens, most people say they feel the same. Our other messages are that there's only saline inside for peace of mind, which is what women want. Importantly, a woman can look in the mirror and she knows that her implants are intact, versus silicone gel implants when she can look in the mirror and doesn't know if they're intact or if they have silently ruptured. This is a new type of breast implant. It is not silicone gel and it is not saline. That's why we call it a structured breast implant. It has the natural feel of silicone gel plus the safety of saline. It is a natural alternative to the silicone gel implant because no longer does a woman have to choose silicone gel to get a natural feeling implant. She can get that now with Ideal Implant. The Ideal Implant is the first new type of implant design in over 30 years. This is an exciting time, and I am happy that your practice is playing a part in the introduction of the Ideal Implant.